Welcome, everyone. Welcome to today's episode. Today, I'm super excited to be interviewing Juni Bucher. I hope I said her name right. Now, Juni was diagnosed with stage 1 breast cancer at the age of 41 in 2019. After beating cancer, she decided to redesign her life. And it's crazy because we all do that. So I can't wait to touch on that. And now works with patients and survivors in her nutritional therapy practice. She's passionate advocate for helping women know their own options and to find peace and joy in their bodies again after the challenges of this cancer journey. Having said all of that, welcome, Juni. Welcome.
Thank you so much for having me, Grace. I'm really excited to be here.
Thank you. Now, you were like me. You were diagnosed with stage 1 breast cancer. So was I. Now, tell us the story. So, in
Mhm.
2019 was it a routine check? Take us through your story.
Yeah, absolutely. So, where I live here in the States, they recommend starting mammograms at 40. I did my mammogram. However, I have dense breast tissue. They didn't detect anything. And so I was walking my dog or an early morning. I was kind of running late for work and I just was walking her around my little apartment. I happened to put my hand up to my chest. I didn't have a bra on at the time. And I noticed a lump. I called my doctor right away. They were able to get me in that day. And because of my age and because I had had a clear mammogram, she didn't think it was likely anything, but she said, I'm going to send you for testing just to be sure. I had an ultrasound set up and, this is something I like to tell when I tell this story is that I had kind of gone through it wasn't like an argument with my partner at the time, but he wanted to come with me to that appointment, the ultrasound. And I said, it's probably just a cyst. That's what everybody keeps saying. It'll be fine. Don't miss work. Just don't even worry about it. He kept insisting that he come with me, and I'm so glad that he did. And I really encourage other people to let their loved ones be a support, even
Mhm.
sometimes when you don't think you're going to need it. Because at that appointment, at the ultrasound, the radiologist told me that not only had they saw two masses, they were quite sure it was breast cancer, and I was not prepared for that information whatsoever. And they sent me right into a biopsy immediately afterwards. And I don't think I could have driven home that day if I was by myself. I think I was in so much shock and I was so emotional because I just, nobody's ever prepared to hear that those words. And I didn't even realize at the time that you could have a lot of assuredness that something was cancerous just by looking at the images on the ultrasound. Because when I asked the radiologist, well, how do you know that without doing a biopsy? He said, it looks a certain way. And I said, well, what's the percentage that you're confident this is breast cancer? And he said about 90%. So,
Wow.
that for me
Mm,
felt like, oh, okay.
mm.
Yeah. And so then I went through the cancer process. I had already been a little bit health conscious prior, but I really tightened up my diet. I was doing a lot to take care of myself and manage the stress, although, every moment kind of became breath to breath, really. I wasn't ever feeling super grounded, even despite my best efforts. And that's sort of something that you have to resign yourself to
Mm.
sometimes. But once they got in, because they had estimated when they did the biopsy, they said they found 2 masses. It was lobular and invasive ductal. But once they actually did my surgery and I opted for a mastectomy, they only found 1 mass. It was way smaller and it was only one type of cancer. So I don't know what happened. I mean, it's apparently you can really only estimate what's going on. Um, but I feel quite lucky that things went in another direction because they were preparing me to have to undergo through chemo. I even cut my hair very short just to my hair is a big part of my identity, my long
Mm.
hair, and they said, cut your hair in stages, it'll be less of a shock. So I got a really short haircut, and um I was really prepared for everything, and then I ended up only doing the surgery. They did the oncotype test on me, and I determined I didn't need, or it wouldn't be of benefit, because I had hormone positive breast cancer, and they gave me a prescription for tamoxifen and kind of sent me on my way, and now I am, yeah, so here I am.
Yeah. Well, first and foremost, yay to that. So since 2019, you're
Mhm,
obviously being cleared every year since, or if you go
mhm,
every 6 months.
yeah.
I just want to go sort of back with that. So you said that you got your ultrasound. So did they base your results just on an ultrasound? Did you have a mammogram? Did you have an MRI? Did you have any other scans?
They did another mammogram. They did the biopsy. They didn't do an MRI on me, actually. I'm not sure why. Some people, I mean, I guess, yeah, they didn't do that.
Mhm.
I did have an MRI in my follow-up when I was working with an oncologist who was a little bit more, I guess, conservative. But yeah, I never had any scans like that.
Mm,
Mhm.
okay, okay. Yeah, because it's just interesting where you go, some people go all out, some
Yeah.
people don't. So I was quite interested to hear about that.
Mhm.
So you do, and obviously your decision was to have a mastectomy done.
Mhm.
Now, was that your decision, or what was that based on?
Yeah, my doctors were very open-minded, in terms of what they recommended. They didn't give me any real pressure to go in one direction or the other. But when I weighed the positives and negatives, to me, I felt like, I mean, at the time, I was under the impression that I had two masses. They said I could do a lumpectomy. They felt like they could get all the cancer, but I felt like I would have more anxiety with
Mm,
without them taking the whole breast, which isn't necessarily rooted in truth. I mean, they say, like, outcomes are pretty similar, but also I was thinking about it from a cosmetic perspective, because I
mhm,
was a candidate for the nipple and skin sparing mastectomy with immediate reconstruction. So
mhm,
I did that. I was able to wake up out of surgery with a breast mound that I felt, for me, would be one of the least traumatic options. And I also, a huge, huge factor in the choice to do that more invasive surgery was to avoid radiation. Because with a
mm,
lumpectomy, as I'm sure your audience knows, you do radiation. That's sort of the standard of care. And I wanted to avoid that if possible, just
mm.
because of, side effects of radiation. So it felt to me like a good trade-off, but not everybody feels that way.
Yeah, absolutely, and I agree because we're here just sort of sharing our own stories,
Mhm.
and one person can resonate with yours, one person can resonate with the next one. So
Yeah.
that's why, because one thing I say all the time is, not we yes, are we all diagnosed with the same label? Yes. Are we all going through the same one? Hell no. It
No.
doesn't who you are. It could be 60 to 80% similar, but it's never the same.
Yeah.
So that's why, take that into account as well. Now, so you've had a reconstruction at the same time. So they've put
Mhm.
in your like a breast as well, done the
Yeah.
nipple and everything. So how did you feel like going forward? So what was the next step for you? So,
Mhm.
you've finished your operation. You're
Mhm.
obviously healing from that. Did they take any lymph nodes out to test?
Yes, they did. They took the sentinel node. They did a couple other additional lymph nodes. I was clear, luckily.
Mm,
It hadn't spread to any of my lymph nodes. And I was able to keep my own nipple too, which was
yeah.
kind of nice.
Mhm.
So I never had that Barbie boob. that some women experience.
Yeah.
Although I will say, there are some really incredible nipple tattoo artists out there. I'm sure you're familiar. So if I had lost my nipple, at least I know there was that option. But yeah, I was able to keep my own nipple, but no feeling in that breast. Which is another one of those things that when women are considering which surgery to do, considering the fact that if you do the mastectomy, you lose all feeling because they're taking all that nerve tissue.
Mhm.
Yeah.
Absolutely. That's
Yeah.
so true because people don't, um like we sort of tend to hear all the time, these things, my breast tried to kill me,
Mhm.
slogans and things like that. And I think, yeah, it is. And then when you remove them, you got to remember you're removing a part of it's like losing a limb in a way, losing a
It is.
finger, losing a toe,
Amputation.
whatever. You're never gonna, it's right. And you're never gonna have that feeling again.
Mhm.
So it is a big deal, and I'm not
Yeah.
here to advocate either way because some women need to, and that's why I asked you if you needed to do that.
Mhm.
I know people who are in the BRCA who then get diagnosed saying because it's a family history, it's genetic.
Yeah.
They tend to go for the hysterectomies and things like that. So so you've come through that part of, and now you're going through your process, you're going through every day. So now you're going to your oncologist
Mhm.
and they haven't suggested radiation, they haven't suggested chemo. However, they've suggested tamoxifen for you.
Mhm. Yep.
So so you're still on tamoxifen?
I no, I am not on tamoxifen, and this is
Mhm.
a decision that, I did put a lot of thought into. I've actually created a free resource for women because it's such a complicated decision. I took I tried to keep an open mind with tamoxifen, although I had done my research, and I am of the school. There's a lot of women who it's better for them to just listen to their doctor and just do whatever their doctor says, and that is
Mhm.
certainly a respectable choice. I am a little bit more skeptical. I've always tended to be someone who experimented with alternative therapies and like to look at sort of a root cause approach. And so in my research with tamoxifen, I was just very uncomfortable with what I saw. I had talked to a lot of other women who had various things to say, but I said, "You know what?" And I asked my oncologist, I said, "For your patients that do well with tamoxifen, what are they doing?" And she said, "Well, typically they're eating an anti-inflammatory diet, they're exercising, they're keeping their weight, in a healthy range and all these things." So I said, "Okay, I'm going to do all of those things." My medical facility gave me like 100 pills. And I said, "You know what? I'm gonna take 100 pills and do all the things," and I had already been kinda doing those things. So,
Mm.
I felt like I was in a really good position. I said, "I'm gonna keep an open mind." And then I felt like I had every single one of the side effects. So then this sent me it was very difficult, and I am a really sort of I've always been somebody who is a very happy person, no mood issues. I felt like full of rage all the time. I had a lot of irritability. It was just difficult. And so that sent me into another phase of things where I started the conversation with my oncologist, and I was also working with a naturopath at the time and doing my own research and doing my own internal exploration of things. So, unfortunately, with cancer treatment, it's not an exact science. We do have
Mm.
some statistics that will show you, okay, this is the estimated benefit, but that's all relative. And for me personally, when I really kind of got down and looked at the statistics for my specific cancer, um, it was such a minimal benefit to me compared to the impact on my quality of life that I said, okay, what I'm going to do is I'm going to work really hard on making sure to manage my stress, um, redesign my life, eat and exercise, and do all the things that will hopefully correct the what I consider to be the root cause of my likely cancer, things that caused my cancer. And with a hormone driven cancer, it is safe to assume that you have unbalanced hormones or you're estrogen
Mm.
dominant. So what can I do to correct those things? And I made the tough decision to go against my doctor's advice. I was very open with my doctors, which is something I really encourage people to do, and listen to their opinions. My doctor, she wasn't like, I don't love it, but I do understand where you're coming from, and I'm not gonna tell you not to
Mm.
make that choice for yourself if that's what you feel is best. And I will say also, because this is something I was reluctant to talk about in publicly for a long time, but I feel quite passionate about now is, I also had this very intensive gut instinct that this was not right for me. And tamoxifen has benefits. I mean, it has, risk factors involved with it too. And it can cause other cancers. Um, you know, this decision is different for everyone. And the benefits really are different for everyone. But for me personally, it's a decision that I decided to um I've gone an alternative route. Yeah.
Yeah. Um, I'm nodding so much that my head's falling off because you just spoke the words out of my own mouth, because that's
Mm.
exactly what happened with me.
Wow.
I with that was that word I was saying. When I saw that word, I went, now the
Okay.
reason being is, like yourself, a disclaimer, we're talking about our own.
Mhm.
What happened was, when I got diagnosed, I also went and had, I had just the lumpectomy done.
Mhm.
I opted for that. And they sent me to a radiologist, and the cons were higher than the pros. Again, I always say, listen, ask a billion questions. If this guy is a specialist in radiology, then he's got to be able, or she's got to be able to answer every question. Same goes with your oncologist. So I remember going to the oncologist, and they weren't thinking of chemo as such, the actual intravene chemo, but they were talking tamoxifen. And one thing I remember was, because my mother passed away with cancer. My
Mm.
mother
I'm so
passed away with um, uteral cancer,
mm.
either cervical or urethral. I always say that I'm so sorry to my listeners, because I know I say I'm going to find out for you, and I never do. But I promise I will find out. So it's either uteral or cervical cancer. And what happened was, they put her on tamoxifen, and then my sisters heard the doctors say, "Oh, well, that's what caused her secondary cancer in the breast."
Mm.
So I remember when I went to go through this, all I remember is my older sister saying to me, "Grace, don't take tamoxifen, because that's how
Oh.
mum got secondary cancer." So you can imagine, like you said, you're at
Yeah.
your oncologist, and you're explaining everything. And the benefits as well were too minimal for me. And
Mhm.
I thought, but the cons again, or the side effects or other things, were much higher. Again, this was my case.
Yeah.
Um, your doctor was amazing. My doctor, because I said to her, "Well, what are my other?" I got diagnosed at the age of 47.
Mhm.
So I said to the doctor, "What are my other options?" And she said, "Well, you can have a hysterectomy done, but then you're going to have to take hormone replacement tablets. That could cause cancer. Then, because you go into to early menopause, that can cause heart failure." Da 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 da. And I'm like, "Well, you're giving me like options that are getting worse."
Yeah.
And I said, "Look, you know what? I think I won't take them." And she looked at me and said, mind you, I waited 4 hours. I was the last patient in that whole, I call it, a five-star hotel, because it wasn't a
Mhm.
hospital, because that's where the money goes, but that's my opinion. But, after 4 hours, she says to me, "Get out of my office. I don't have time for you."
Ugh.
And I thought to myself, is that because I didn't give in on your demand? We're not here to say go against your doctor.
Mm-mm.
One thing, my friend, until this day I use it, he said, "Grace, don't ever make a decision based on fear." Now, my doctor, I've been cancer free as well. The last checkup I went to was September. I think it was September or August this year. August, September. And she's like, so are you on tamoxifen? I'm like, have you been sleeping under a rock? I've been coming to you for 4 years. I said, no, I'm not. She's like, oh, yeah, nah. I'm 51 now. I'll probably go into early menopause. So let it be. Let it
Mhm.
be.
Mhm.
Again, it's not because I don't want it. It's because I don't want it, because in your case and in my case, we could see the pros and cons.
Yeah.
And that's what we're saying. So that's why I was nodding my head, because I was like, oh yes, someone who asks questions, and I like that, because like you said, there are those that if a doctor says, I need you to hop on one foot for the next 15 hours, they'll do it for 16 hours
Mhm.
without asking questions. And I think it's not, the thing is, they all have their best intention. You worked with them. That's
Yeah.
my said to my doctor, don't work against me, work with me.
Yeah.
So I really wanted to touch on that, because I just thought, oh my God, that is just, yeah. It's not the fact that you didn't take the tamoxifen. It could have been any of the other ones. It was the fact that you did your research to find out what was great and what wasn't for your diagnosis, like
Mhm.
my own.
Mhm.
But now you touched on also, which I found that as well, that affected me. Your sex life. Let's
Mhm.
touch on that, because
Yeah.
I know of a lot of women who don't wanna have sex. You
Mhm.
know what I mean? They feel turned off. I know I was one that I was, and I'm very open on my
Mhm.
podcast. I'm one who sometimes I can go through months like a bunny, and you'll be like, "Holy cow, Grace, just slow the hell down." And then I can go through months where it's like, "Nah, nah, nah, nah," you know?
Mhm.
My poor husband, I love him to death. But you know what I mean? But it's like that. So let's touch on that, because you
Sure.
said, how the libido affects your hormones. So
Mhm.
yeah, take it away.
Yeah, I mean, I first of all, I just wanted to say I'm so sorry that you had that experience with your doctor, and I hear that so much, and it upsets me. It upsets me
Mm,
that doctors I don't understand. I mean, I hear people all the time, "I got yelled at." Like, what in the world? Anyway, but,
yeah.
so in terms of yeah, I mean, there are so certain drugs, tamoxifen or, some women who take tamoxifen have really intensive hot flashes, and one of the ways that doctors will address that issue is to prescribe an antidepressant called Effexor, which has a side effect of helping with hot flashes. A lot of antidepressants can actually cause an impact to libido, so there's
Mm,
a lot of medications. Plus, if you're experiencing a major decline in the way that your body is dealing with estrogen, just like as a natural progression in our hormonal cycles through life as women, there can be a natural decline. And, something to note of just what you were saying, like you have moments or months where you're feeling really high libido and months where you're feeling low. And that's, sexuality is about energetic flow as much as
mm,
it is about hormonal
mhm,
balance. But
mhm,
if you
mhm,
have no libido, that can be an indicator that you're out of balance. And a lot
mm,
of the time, it what I see in my practice is it comes down to stress. Um, whether that stress is just because you're not eating a balanced diet and your blood sugar's all over the place, your body's in a chronic state of stress, or like stress that you could see and outside externally that's going on that's maybe affecting your sleep, all these different things. I mean, stress is the number one killer of libido. But
absolutely.
if you don't feel good in your skin, if you don't feel like you have energy, if your mood is unstable, of course you're not going to feel libido. And libido is a good indicator of your overall state of health and vitality.
Mm, mm,
Now, I always like to say that if you're a woman who has no interest in sex, like, I mean, sexuality is a spectrum, and there are people who identify as asexual, and there's nothing wrong with that if that is your choice. But if you are missing that element of
Mm.
your life, or you want to bring that back into your relationship or just you as a person, there are options. And that's what I think is super important to talk about, because a lot of women give up hope
Mm.
sometimes. You know, if estrogen levels decline, you start to see some atrophy of those tissues, which might make intercourse painful for some women. You know, if you're experiencing actual pain during intercourse, of course that's going to be very off-putting. Then that gets in your head. So there are things that you can do with, you know, whether it's a pelvic floor physical
Mm.
therapist, or, you know, self massage, different types of vaginal moisturization, working on hormone balance, stuff like that. And mindfulness is actually a very powerful tool as well, that has been shown to help women. And there have been studies done on women who've had gynecological cancers that have caused either lack of desire, painful intercourse,
Mm.
different things like that. So there is hope, and that's what I like to let people
Yeah.
know. Yeah.
Absolutely, and I agree with you because, it does because, you hear of these, and call them sad stories where women don't have the drive anymore. They don't
Mhm.
understand why. They just don't. They have the drive. They believe, okay, because I went through the cancer and everything. Some women, it's because they've had the mastectomy. Some women, it's because they've had the chemo, radiation, whatever it may be, and they sort of don't look into the whole thing. And then I hear stories of either men saying, well, you can't give me what I want, so I'm just going to have something on the side, or women encouraging their partners to go out and get it from someone else.
Yeah.
And I'm thinking, look, I'm one to believe, and it could be my own opinion, but I'm one to believe that cancer is also part of a dis-ease. So
Mhm.
imagine you're recovering from a cancer, but now you've got your partner who
Oof.
you're not connecting with, who may be sleeping with someone else. Tell me that's
Mm.
not gonna psychologically, spiritually, you know, affect you. You know what I mean? And then
Yeah.
physically, it ends up causing more issues because
Yeah.
you're suppressing that emotion, you're suppressing it. Yes, I'm not here to say, like, someone could be listening or watching thinking, "No, no, no, I'm actually really okay about it." Are you really okay? Because if that's the case, maybe you had an open marriage in the first place, or an open relationship in the first place. But if you don't have that and you then
Mhm.
introduce that, I don't know. I think it's going to cause a little bit of, discomfort in your soul, in your system, that
I
can
mean,
cause other issues.
yeah, you know, I agree. I love that. I feel like we're really aligned in just terms of like, you know, cancer is can be a bigger issue, I am a firm believer in the relationship between emotions, a trauma history, and breast cancer. You know, but yeah, I absolutely. I actually hear that a lot, and I work. I'm the nutrition professional with the Rose City Sexual Health Collective here in Portland, Oregon, and one of our therapists actually specializes in helping couples navigate an open relationship. They
Mm,
call it ethical non-monogamy. And yeah, I do think there is some people can make that work for them, but it's usually it's going to take a lot of effort. It's going to take a lot of communication, and it can be
absolutely.
difficult to navigate without you know, some hurt feelings or bruised egos and jealousy. But at the same time, yeah, there's this anxiety that so many people experience, whether it, you know, anywhere from are you having erectile dysfunction, or are
Mm,
you having so much pain during intercourse that you feel like your partner is going to leave you. And you know, and obviously we want to believe that our partners are going to stand by us through anything, but sexuality is a big part of a romantic relationship, and
mhm,
I firmly believe that, you know, that can be very painful for both parties if you don't feel wanted or like your partner enjoys being intimate with you.
mm,
Again, there are ways to support therapy, I think, is really important. And again, there's a researcher. Her name is Lori Brado, who works in British Columbia. Who this is a big part of her work with women and helping cultivate desire, helping them change their relationship to pain, helping them minimize the anxiety of, because that can make it worse, right? If you're
Mhm.
thinking, "Oh my gosh, if I don't perform, my partner's gonna leave me," and you have this
Yeah.
anxiety, and that's a thought. Because even if your partner's sitting there saying, "No, I love you. I'll be patient through this," like,
Mhm.
I think it would be almost impossible not to have that thought. So how do you detach from that thought long enough to be present? And
Absolutely.
really, and then how do you explore other avenues of intimacy? Because intimacy does not have to necessarily equate intercourse. And
Mm.
connecting with your partner, or
Absolutely.
can involve so many different things that can be very pleasurable. And I think it's also important to touch on the fact that if a relationship that goes through a cancer journey, you do make a switch from romantic partner to patient and caretaker. How do you navigate coming back
Mhm,
to this
mhm,
former thing and
mhm,
also
mhm.
resolving your new normal? There's just so
Mm,
much, which is why
absolutely.
my practice has kind of gone a certain direction of, like, I want to help people navigate this other side of things. And I do it. I have my arena that I work in with the nutritional therapy and the mindfulness, but I do work in conjunction with a bunch of other holistic practitioners who are either doing the cognitive behavioral therapy, talk
Mhm,
therapy, or the pelvic floor therapist or acupuncturist. We do things collectively to help people get through and really find solutions. But it's not necessarily an easy undertaking, but if you open your
mm,
mind to it, the most beautiful thing is that you can emerge on the other side even better than you were before. And
yeah.
I believe that's where I am. I really feel like my health, my vitality, my joy for life is exponentially greater on this side because I've been doing the work, and the work never ends. Unfortunately,
Absolutely,
but
absolutely.
it's a journey.
Yeah, absolutely. I know what you're saying because, it's like it's funny because like you said, in the beginning how I read that you redesign your life. It's
Mhm.
like I always and people sort of look at me, how's it a blessing? I always say for me breast cancer was a blessing because it allowed me to control alt delete and start again.
Yeah.
Get rid of things that were no longer serving me. And when I say that, I'm not talking about like you just wake up one morning and go, I don't love you anymore. Get out. I don't want this job. It's not that. It's just knowing it was your environment. It's your
Yeah.
home. It's not only what you're putting in, it's what you're surrounding yourself with. Like the
Yeah.
moment you walk at the door, if you're hesitant to open your front door, why? That's
Yeah.
your safe haven. So it was a lot of things and I had to touch on that because you said, you are much better on this side, and I think I am as well. I say to people, because I used to be a people pleaser, I used to yes, 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 be stepped on. And now don't get me wrong. I mean, I did have to learn how to put my blowtorch away. I'm a sort of person who will incinerate you and then ask questions. So I didn't get rid of it. It's just there, but it's on low.
Mhm.
But I had to readjust all of that because now instead of saying yes and then rah, I learned to say no, which was yes to myself. So I just wanted to touch on that. But going
Yeah.
back to the women, because I remember interviewing one girl. She was young. She was younger than both of us. I think she was 37, 35, 37. She had a double mastectomy. And she said, Grace, I now have these aliens in me,
Mm.
you know? Now, I don't know what that feels like to have. breast implants. So she said to me they were aliens, Grace. And she said, and I don't know what to do, in the sense she was in a gay relationship as
Mhm.
well. And you would think, and I'm not being, I'm not a pro here, I'm not lesbian myself, but you would think a woman would know how to, understand another woman in sexual, to have sex with and things, but she said, Grace, I don't even know how I can be with my partner. And it's one
Mm.
thing the doctors don't teach you. They just go, yep, you're good to go. You're all good. You're cancer free. See you
Yeah.
later. Have a great life. And she
Right.
said, and now I look at myself and go, what the hell are these things?
Yeah.
Because, like you said before, you have no sensation, you have no feel of it. So there are women who either have breast implants or they've opted for the flat chest, which is great too.
Yeah.
Either or, it's fantastic.
Yeah.
But what about that side, the intimate side? You know what I mean? Like, it's
For
great
sure.
and all, like, God forbid, like, I will never ever want them. But if I was, able, my husband would never let me. But if I was able to get nice breasts lifted up, because sometimes I feel like they're down to my knees, things like that, I'd be showing them off to the world. But that's a, how do you say it? That's a physical aspect. It's not a psychological, and it's not an intimate side.
Mhm.
So what about women like that? Women who either have had implants, double mastectomies, or have decided flat chested. Have you come across women like that you help?
Yeah, I mean, it's it's such an interesting journey, that decision and how you wanna do it. Are you a candidate for an immediate reconstruction, or do you have to
Mm,
go through the process of the expanders being placed, which a lot of women say is more painful
yeah.
than the mastectomy surgery? I mean, they categorize a mastectomy as a relatively painless surgery, which to me kind of blows my mind. I'm like, that was
Mm,
not painless, but because they are taking all that nerve tissue, they're like, the pain is relatively low. Um, but yeah, I think one thing to touch on this subject is, I'd be curious with this woman that you talked to if she felt like her surgeons really gave her all of her options. I think it's so
mm,
important, and one of the reasons why, with why I started my podcast was like I don't feel like I was ever really told that if I didn't want implants, I didn't have to have them. The whole movement of the aesthetic flat closure is really big. And I know a lot of women who really own it, own their flatness, own maybe their asymmetrical
mhm,
bodies.
mhm, mhm, mhm,
And for me personally, I never had my surgery recommendation was to have this immediate reconstruction and then eventually have a lift on the other side so that the a breast matching surgery. I decided not to do the other breast just because I don't know, I just wanted to be natural. I didn't want to mess with it. Ultimately, the plastic surgeon said, "Yeah, you can have this surgery, but you're essentially trading scars for symmetry." And I said,
mm.
"Oh, that doesn't I don't know about that."
Yeah.
And, and after losing the sensation in this breast, and seeing how that kind of affected my sex life, I said, Yeah, I think I just wanna leave that one as is." I mean, but that brings up a whole other thing that I've been really vocal about in the community, and, I had an essay published, um, about my experiences with dating, and how do
Mm,
I because there's a conversation that has to happen. I was in a relationship at the time that I went through cancer, but that was something that at the end of the day, when I was redesigning my life again, this was a perfectly wonderful person, but I
mm,
knew I wasn't really where I wanted to be, and I made a very difficult decision to leave that relationship. And I've been single, I've dated, but like I'm not married, and that's so I'm navigating the world of dating, and there is a conversation that needs to be had before I
mm,
get intimate with somebody,
mm,
because the worst thing to me, my worst nightmare is I don't tell somebody, what's going on, and I see something on their face, or they have a reaction, which I wouldn't I feel like there's clearly a difference between what my breasts look like and what natural breasts would look like, because one is not natural and one is.
Mm,
So, yeah, and I've been lucky enough. I mean, I feel like I have decent taste in men, and I'm not gonna date somebody that I don't think would be encouraging or supportive of my
mm,
situation. I do feel like American culture is good about supporting the cancer community and making them feel empowered. And so many people have been touched by breast cancer that it's not like such a foreign thing,
mm,
sadly,
mm,
to most
mm,
people. But yeah, I mean, there have definitely been I've been really happy with, uh, you know, I give props to the men that I've dated and their reactions and the way that they've handled that conversation, because I had a lot of anxiety about it at
mm.
first, and so far so good.
Yeah. I actually remember, just touching on that, I remember saying to my husband, because, we speak openly about things, and I said, imagine, because, as I said, I know so many women who've had, one or both taken and things like that.
Mhm.
And I said to my husband, imagine, a woman having to date, um, and, having one breast, they haven't had a reconstruction. And I remember my husband saying, well, it'll be a new adventure for the
Mm.
guy. And I
Yeah.
thought, yeah. And I thought, really? And he goes, yeah, it'll be something like, wow, this is different. But not, he never said it in a, and
Yeah.
I was really proud of him, and not because he's my husband, but I was proud of him as a man
Yeah.
to say that, because he didn't have to. He could have gone, "Oh God, no." Instead, he
Yeah.
went, "Nah." He goes, "It'll be really." He goes, "It'll be adventure. It'll be something different. It'll be
Yeah.
awesome." And I
Yeah.
thought to myself, that could have been me.
Mhm.
That could have been me. Um, had things turned out, where I had to. So yeah, like dating, and like you said, the thing is, we're in a society which is great, that we can be open, but you still have to be mindful,
Mhm.
because like you said, you could be open. I've seen people where they do social experiments of, they meet someone and they catch them at the at a cafe, they catch up with them, and the woman's in a wheelchair and they walk away,
Yeah.
things like that. And it's like, well, hang on a minute, this is real as well. Not everyone sweeps the girl off the wheelchair and lives happily ever after. So
Right.
we're speaking about this because this is something that a lot of women, it's not, you do not choose
Yeah.
this.
Mhm.
It's not like you said, it's not like plastic surgery where they go, would
Yeah.
you like your breast or would you like them removed?
Yeah. Yeah.
You
Definitely.
know, so I take my hat off to the guys you're dating and to yourself, like you said, because, that's, having that conversation and not knowing how are they going to react. Um, but has it been more the positive reaction than the negative?
Oh, yeah, I've never had a negative reaction, and,
Perfect.
I am a very open person. I know that other personality types might really struggle to get to that point of feeling
Mm,
safe enough to disclose that information. And when I talk about this to other people, I usually say, yeah, um, take it at your timeline. But I just
mm.
never wanted to have somebody be surprised. But
Yeah, of course.
I love that your husband said what he said, because I will tell you that was, the first man that I dated, that I had to have that conversation with. He was, perfectly supportive, and then when things happened, I mean, we dated for a number of months, and at one point he said to me, I actually really love that you have 2 different breasts. Like, he found
Mm.
it very interesting and sort of novel. And I was like, I was so surprised by that. I mean, I
Yeah.
honestly, I just want someone who, I mean, I think the standard reaction is some form of, well, I think you're beautiful and sexy, regardless, and that's not going to change because of this. But I mean, that's a perfect response. But
Yeah.
really, like, what is your body gonna, how is your body gonna react? But in general, and I've actually been on podcasts with men, and I like to talk to men about this. I think it's an
Mm,
important
mm,
conversation to have, because
absolutely.
they don't
Mhm,
necessarily know, like, what does feel supportive to a woman who's in
mm,
that
mhm,
scenario.
mhm,
And and most men tell me, you know, most, straight guys, they just like boobs. It doesn't
mm.
really matter. So, and yeah, and if you've built some kind of relationship with somebody, hopefully they're going to see you as more than just your physical being, and it's
Yeah,
going to be
yeah.
the entire
Mhm,
package
mhm,
that
mhm,
creates your level of
mm,
attractiveness to them. So I have never had a negative reaction, thank goodness. And it's not like I've been dating tons of people, so I don't have this
mm.
conversation with a ton of
Yeah,
men.
yeah.
But I have dated, a handful of guys, and they've all been
Mm,
great.
mm.
I'm a lover of men. I think men are, there are so many good guys out there. There's definitely, I'm sure there are plenty of men that would have a negative reaction, but they're just not the type of person I'm attracted to. So it's a good
Yeah.
litmus test. I mean, I always figure if
Mm.
somebody were to have a bad reaction, I would know very easily, like, okay, this is not somebody that I want to date.
Absolutely.
Yeah.
Because but when I look at my relationship, I'm in a marriage,
Yeah.
and when you take your vows, it's good times and bad times, in sickness and in health. God forbid anything could happen to us. Does that mean I just turn up and go, "Oh, well, you don't have what you used to have. See ya."
Yeah.
Things like that. But it's the same with the relationship, because when you were just talking, I was also thinking, yes, men are boob men. They generally are, yeah, I'm a boob man. But there's men that are like, oh, I'm an ass man.
Oh, for sure.
And things like that. Now, if a man was genuinely into you, he couldn't care if you had a third nipple on your shoulder, in that sense. It's
Yeah.
like, what is there? Because they just want to be intimate with you.
Mhm.
What a man's role is, or what they want to, when it comes to sex, is they want to make sure that they satisfy you, that you're
Mhm.
getting all the goodies. So they're not looking at all the bad stuff. They're looking like, I just want to blow this chick's mind, and things like that. So, and going back to flat chest, there are so many women. I know one, I'm not sure if you've heard of her. She's now a Victoria's Secret model.
Really? Oh, that's
Um,
awesome.
she's amazing. She's amazing. Her name's Christine Handy. She's out of Florida. Amazing. She's an advocate for flat chest. She's
Yeah.
done runways. She's done the Fashion Week. I think she did New York Fashion Week just recently as well. It's her second year. So these are the people, like, when we go back to, and I know we're just sort of touching it, it's because this is part of the conversation people don't have.
Yeah.
Like we're saying, you've had the physical side of you done,
Mhm.
as in, like, you've had your breasts taken, whatever. But what about everything else that comes with it?
Yeah.
Um, Now, one of the other things I wanted to ask is, so we say that you're going to be trauma. We spoke about trauma. I believe, in my hallucination, in my journey, um, my trauma contributed to my breast cancer.
Yeah.
So I went through childhood trauma, things like
Mhm.
that. So yes, was I surprised? Yeah. Was I surprised? No.
Mm.
So that's what I always say, in that sense. But when you can flick that switch and realize, being mindful, be mindful of your cancer diagnosis, where it's brought you here for a reason.
Yeah.
So, what is your take on that? When you think about,
Mhm.
right, you know, this has happened for me to be mindful.
Mhm.
What did you take out of that?
Yeah, and, I love that you're you want to talk about this because it's very fascinating to me. I've really gone deep down the rabbit hole of this,
Mm,
and there have actually been scientific studies that have shown that a lot of women who have been diagnosed with breast cancer have a significant emotional trauma in their history, and a lot of times it involves divorce. For me,
mhm,
that was the case. I had a very traumatic divorce about 3 years prior, and
mm,
almost every one of my clients, whether it was divorce or just something that created heartache. And I was reading something the other day, I don't remember what, but it was like, if you think about if you really kind of get it a little bit woo woo about this, think about like the breasts, they are kind of like a chamber for the emotions of the heart. And so, if you have this just incredible heartache, I know in Chinese medicine, like grief is held in the lungs, but if you think
yes,
about like the female heartbreak, um and the breasts being these, almost like a resonant bells of chambers for your emotions, that makes a lot of sense that you would be affected or stripped of this like female organ that you have
mm,
when your heart is really ripped out. But the whole thing about the history of trauma in childhood, that is a big factor. And it's so difficult because a lot of people can agree with this concept, but what do you do about it? Like,
mm.
and that, so I think
Yeah, of
that's,
course.
like that, it's easy to be like, yeah, that makes sense. Sure, stress and my history, it probably got trapped in my body somehow. How do we work with that? And that's such a journey in itself.
Mhm.
There are things like emotional freedom technique, the tapping. Have you heard of tapping?
Yes, yes, yep, yep.
That can
Mhm,
be
mhm.
really powerful. Mindfulness therapy, journaling, really learning how to sit with and release emotions. If you're a religious or spiritual person, maybe you take that into your religion and ask ask your God
Mm,
to alleviate you of that. Ask forgiveness is a huge
mhm.
thing. When you read about cancer and emotions that are associated with cancer, there's bitterness, emotions of helplessness or hopelessness,
Yep,
um,
yep,
non-forgiving, not forgiving those who have wronged you. And I think it's important to note that forgiveness is really about you. It's not really, it's not condoning somebody who may have really betrayed you. It's about
yeah,
you giving yourself the freedom from that pain. Because
yeah.
yeah, revenge, I think there's a great quote about revenge, is like, it's like taking poison and
Mhm, and
expecting it
hoping
to.
someone else dies, yeah.
Yeah,
Yeah.
yeah.
Mhm,
Yeah,
mhm.
so I love this topic, and I think
Mm,
it's, that's why I've read a lot of books on this, and it's such a vast subject, but it's why getting in touch with your feelings, looking at your history of trauma, and
yeah.
then really finding, where can I forgive and
Mhm,
where can I let
mhm.
go, and um, trying to do that work to find your freedom.
Absolutely, absolutely. So I'm in the process of just publishing a journal, and one of the pages is about forgiveness.
Mm,
So, I'm not writing a whole book about it, but it's just like you said, and it's not forgiving the other person as such, it's forgiving yourself. When I
mhm,
talk about my childhood trauma, I was a child of physical abuse. My father used to
mm,
physically abuse me.
mm,
And so I forgave myself first and then I forgave him. So, and to the point where he passed away this year, but I'm at peace with everything. And it is about that. It's finding, it's not, like you said, it's not about, oh, here it is. It's, now what do I do? And you don't know what to do with it because that's
mhm.
worse.
Yeah.
Because what happens is if you bring it up, And then you go, what do I do now? What do we tend to do? We tend to suppress it even more. So it's obviously finding resources, tools to help you, find what is it? How do I deal with this? Things like that. And like you mentioned, there's so many different tools and resources to help you with that, whether
Mhm,
it's speaking, whether it's tapping, whether it's, I did Vipassana, which is a mindful meditation
mhm,
of 14 or 16 days, I can't remember, of silent meditation.
mhm.
I never meditated in my life,
Oh,
and I
wow.
did it. So,
That's
yeah, it was
jumping
pretty,
to the deep
but it was a
end.
lot of stuff that came up.
Sure.
And obviously, if you know what to do with that, in my case, I came home, thank goodness. When I say thank goodness, my husband's a life coach.
Mm,
So I came home with a bag of BS, and I basically said, what do I do? And I unpacked that bag one by one, one by one. And he just sat there. He held space.
mm,
Um, Another thing that I did was I obviously went over to Peru. I did medicine work with shamanic medicine. That also helped me bring up a lot of, because a lot of people think when I say that it helped me on my breast cancer journey, I'm not going to sit here and say, well, that's what made my cancer go, because when I got
mhm.
operated, they couldn't find it. But I think it was a matter of everything. And one of them was definitely, definitely the emotional side, the
Yeah.
psychological side. And I always say that if you don't fix the heart and the mind, it doesn't matter what you do, it'll come back.
Yeah.
Um, I truly believe that. I truly, truly believe that. Um, so when when women are just being diagnosed, because like we're saying, we're both, see, isn't it crazy? We're both,
Yeah.
I was going to say first timers, God forbid. We don't want to be second timers or third timers. We're both, diagnosed with, what do you, I'm
Early
all over the place.
stage.
Stage one,
Yeah.
yes.
Mhm,
But we're different paths, we're different journeys
mhm.
and things like that. So, what are the 5 things that you um, want others to know going through a cancer treatment?
Yeah, I mean, we've touched on so many of these things and, yeah, I'm fascinated that I've actually never met anybody who had kind of a similar experience where,
Mm,
it was way less than what was going on, and yeah, I think there are a lot of stories about radical remissions,
mm,
when people do emotional work or deal with trauma, but, I mean, so I touched on this before, like, allow your support system to support you, whether that means if you have a partner who's going to come to an early appointment with you or any appointment with you, always
mm,
having somebody there. That's great. Um, Find a way to manage the stress because your body is being depleted of so many nutrients just dealing with the overwhelm of the cancer experience, and you need more nutrients to heal, and
mhm,
and just manage that stress. So adopting some type of mindfulness or stress management, whether that's exercising, yoga, doing something creative, meditation obviously is really, really helpful. And that's a big thing for me. Um, Fueling your body is
yeah.
incredibly important.
Mm,
I mean,
mhm,
I'm a
mhm.
nutrition person, obviously, so you. But a lot of people I've seen with a lot of my clients, they just completely lose their appetite and they don't know how to eat. Or their doctor, which this kind of drives me nuts. Their doctor just says, "Oh, eat whatever you want, just don't lose any weight." And it's like,
Wow.
that's terrible advice. Like
Mm,
I mean, I people get very sensitive about this. So, food is incredibly personal and emotional, but I mean, you need more protein to heal. You
yeah.
need nutrient density at this time in your life. It is a major time in your life, and you can emerge from a cancer diagnosis better than more stronger than before, in all senses of
Mhm,
the
mhm,
word, if
mhm.
you, like, pick up some good habits. Now, that being
Yeah.
said, the stress of the whole experience can be very overwhelming for people, so don't beat yourself up, but, get the support that you need or,
Mm,
let people when people say, "What can I do to help?" if you are trying to follow a nutritious protocol, you give them recipes. People are dying to help you. They just don't necessarily
Yeah,
know what to do. And I
absolutely.
mean, and so, yeah, I like to say, because I love to cook and obviously I'm very passionate about food, is like, are you following a certain protocol? Like, let me make
Mm,
something that you can freeze and put in the oven. And then that way, when you come home from surgery, you have food. Your caretaker isn't overwhelmed, like waiting on you hand and foot,
yeah.
like things like that.
Mhm.
And then just, I also encourage women to really, well, to give themselves a break, if possible. I mean, not everybody has the ability to take time off of work, but there is a lot out there. I mean, I went on medical disability. I had no idea what that was. It was very confusing, but
Mm,
I also, I was like, I am not going to try to be some kind of multitasking hero right now. I I was able to look up resources and go on medical disability and really spend time like focusing on my recovery. And I think that was really important to like it really helped me heal quite quickly and take care of myself well. So I think that's 5 things, but we could go on forever.
yeah,
There's
yeah,
so
absolutely.
many things. And then, once
Mm,
you do end treatment, a lot of women feel really lost and there's a lot of conflicting information out there. So, you know, join a support group. I do workshops for organizations, but I also work with clients one on one. Like if you want to create a plan, know that you can really make changes that are going to affect every part of your life and maybe
yeah.
even make your life feel more fantastic than it ever did because you're over this people pleasing a lot of
Mhm.
the times. You realize, hey, life is short. And if I don't, my whole theory was I don't want to do things I don't want to do. I mean,
Yes.
adulting is, you don't really have
Yes,
a
one
choice,
thing.
but hey, I get to choose. I
Yeah,
kind of you get to choose your destiny. You can, if you're
absolutely.
willing to take a chance, you can make extreme changes in your life and it feels really great when you feel aligned.
Mm, absolute
Yeah.
and I agree with everything you said because, it's the thing is this is I always say to people when COVID happened, I always said to people, use this as being diagnosed. People, detox, detox your environment,
Yeah.
detox your community, detox the things around you. Just cleanse everything that no longer serve you. I
Yeah.
said, use it like your own diagnosis.
Mhm.
And a lot of people are like, I don't know what you mean by that. And it's like, well, I had to get the bat. You don't have to get the bat. So,
Yeah.
and it was, learning how to it's like it's whether you believe in whoever you believe in, great spirit, God, whoever, it's like he's saying to you, you're not living your authentic self. I put you on this earth for you to live the most amazing version of yourself.
Yeah.
And you're not doing it. You're gonna, and they give you the feather, and you're like, "Get the feather out of my face! I can't." And it's like, but I'm here to remind you.
Yeah.
Um, and I always say that as well. Whether you're being diagnosed with stage 1 or stage 4, you have the chance to I know, personally know someone. I've known Antonella. My sister actually told me that she was married 31 years. So I've known this lady probably 35 years. She went through stage 4 aggressive breast cancer.
Mhm.
She's with us today.
Amazing.
So don't ever feel like it's a death sentence because it's not. Don't
Yeah.
let it define you. It's
Yeah.
not who you are. I used to say to people, I carry it around like an old handbag. You're coming with me. I'm
Yeah.
not going to stop living. Now, you said that you've got some tools and resources. I really want to touch on your podcast.
Mhm.
Ta-da! Cancer. I love
Yes.
that.
Yeah.
I hope the doctor didn't say it like that to you. Ta-da! It's cancer.
Oh, no, it's Tata cancer.
Oh,
So
Tata. Oh,
Tata, like
Tata.
tatas, but
Tata.
Tata, yeah,
Tata.
Tata to
Okay,
dog
that makes
cancer.
more
Oh, how
sense.
funny. Yeah,
I thought
yeah.
it was the other one,
No,
but
no,
that
no.
makes more sense, like,
Yes.
"Bye."
Yes,
Yes.
yeah, but
Um
also that's, slang for breasts. So,
Oh,
yeah.
oh, yeah. Oh, it is
Yeah,
too.
tatas, tatas.
Tata, yes.
So, yeah,
Oh, how crazy. I
so
forgot my English.
yeah. Yeah, we have, every culture has their weird slang. So,
Yeah, but I was thinking like, "Ta-da!"
yeah,
And
oh,
I
that's
thought,
so
"Geez, I
funny.
hope
Oh
your
my
doctor
gosh.
didn't say that."
That's hilarious.
But people can come and, listen to
Mhm.
you on your podcast.
Mhm.
So
Yep.
Tata Cancer.
Mhm.
And also you mentioned that you had some workbooks, some
Mhm.
workshops, self-love dance party lists, which I thought was
Mhm.
great. Dancing,
Yes.
dancing. Again, I know it sounds like a cliche, but in my journal, I've got dance like
Yeah.
no one's watching. I've got all
Yeah.
these things in it. So what else did you want to share with our listeners and our viewers today?
Yeah, I mean so I've got on my website junibewell.com there's a freebies tab and you can access all these things. There's the tamoxifen facts and feelings workshop. So if you're struggling with tamoxifen, how do you kind of calculate what the benefits are and how do you discuss it with your doctor? What are the questions that are important to ask you? So it's like a workbook. The self-love dance party playlist, it uses a technique called habit stacking that I think is great, where basically
Mm.
like dancing, exercise is very good for any breast cancer patient or survivor. I
Mhm,
mean, if
mhm,
you're
mhm,
about to go
mhm.
into surgery, movement is so important for you and your lymph
Yeah.
system. It's going to help you heal better,
Mhm,
but
mhm.
also exercise is shown to reduce your risk of recurrence. So here is a playlist that's going to help. It's got all these songs that I personally picked that make me feel really kind of, they're the songs that you can't not dance to, but they
Yeah.
also kind of pump you up. So it's something where I'm like, use this with your support group. Maybe if you're having
Mhm.
like a party, or just if you're doing chores around the house, you don't have to use it for a dance party. I have a friend that doesn't have breast cancer who's like, oh, I use this to run to. It's just like a great
Yeah.
thing. And then I have my last resource I'll mention is my breast cancer grounding kit. These are all
Mhm,
free, and that's basically for those early days when you're just
mhm.
so overwhelmed and you're in shock. It's got a recipe that it was perfect for the seasons right now, fall and winter. That's all of these ingredients that are shown to help with grounding and healing. It's also got journal prompts so you can kind of ground yourself and sit with the emotions that you're going through. And it's got a guided meditation that's specifically about
Beautiful.
helping you feel supported during this particular time of the cancer journey. And yeah, anybody can access those and people can write to me. There's a contact form there, or yeah, if you listen to the podcast, my podcast is kind of focused on women diagnosed under 50. So because I feel like there is a
Mhm,
specific
mhm.
set of issues that people are dealing with in that phase of life, but it's also an exploration of what does it mean to heal. So mentally, spiritually, physically, what does it mean? And I bring in a lot of other people on the podcast. I'd love to have you on and talk about your journey and your
Yeah.
experience, and
Mhm.
just sharing wisdom. And not everybody is a breast cancer survivor. Some people are just practitioners that are working in modalities that I think would be really beneficial for people to explore.
Yes, and I
Mhm.
love that, and this is why I love interviewing people like yourself because I love thinking outside the box.
Mhm.
I
Yes.
always say to people, "I'm not here to tell you, I will never tell you what to do. The
Yeah.
one thing I will ask of you is open your eyes and think outside the box. That is all I
Yes.
ask.
Yes.
If something doesn't work, great, try something else. If that doesn't work, great, try something else.
Yeah.
Don't think you're limited. And that's why I love having people like you because this is another part. This is this is so many tools that you can put together. Like you said,
Yeah.
this is now someone who's sitting here who says, Grace, I don't resonate with you. I'm sorry.
Mhm.
Because you didn't have your breast removed or whatever it may be. But I resonate with Junie now. So,
Mhm.
things like that. So I really, really
Yeah.
appreciate you having on my show.
Thank
Um,
you so
Is there anything else before we wrap it up?
No, but yeah, I love that. I think we're very similar and very aligned. And I'm just somebody that, yeah, I was like, I ask questions, I think outside of the box, and my yeah, I just want people to have information because I can't make make your decision, and I'm not trying to push any
Yeah.
philosophies on you, but have all the information in front of you so that you make the decision that you feel best with, because cancer is and the decisions that come up during a cancer journey are so difficult. So, how do you
Absolutely.
feel most aligned, body, mind, and heart? That's my goal. But thank you so
Yeah.
much. This has been such a great conversation.
Yeah, I mean, I loved it as well. I just there was one lady that I interviewed a couple of months ago, probably more now, and she said to me, "One thing you got to remember is your body is not trying to kill you." And I
Yes.
thought,
Yeah.
wow, that is, and I thought that is so profound because it's
Yeah.
true.
Mhm.
The first thing we think of is, oh, we're going to die. Like my surgeon always says, when I asked my surgeon, I even had my surgeon on my podcast, and
Mhm.
I said to her, I said, do people, I didn't ask her this question, I don't think, on the podcast, but one of the things was, so do you tell people if they're going to die? And she says, you know what, Grace, I get people ask me all the time, and all I can say is, I don't know. You can
Yeah.
walk out here and get hit by a tram, get hit by a
Yes.
car. I
Yeah.
can't tell you. So, and I thought that is the best. Don't make it a contract. Whatever
Yeah.
you've been diagnosed with, don't make it a contract.
Yeah.
It doesn't, like we're saying, stage 1, stage 4, don't make you a contract. Live your life to the fullest. I believe we're on the same page when we say no matter what happens, in 100 years, whenever it is where we check out, we go, you know what? I was able to change it around, do it my way. I'm good to go. Thank you so much.
Yeah.
And having said all of that, thank you again, Junie. I will have all your details in the links below. You can, follow Junie at Junie Be Well or Junie Bush. Now,
Boucher.
Boucher, that's right, NTP at her Facebook. But I'll also have all your other links of your website as well, so people can, reach out. I am sure that Junie is more than willing to answer any questions you might have, and help you on your journey, like we're always here to help us. So thank you again. And for
Yeah.
everyone else, thank you for listening and watching. And like always, I send you so much love and light.